alarms. More than a dozen passengers and crew members test positive for COVID aboard a ship in New Orleans, and officials believe at least one person may have the Omicron strain. House Speaker Nancy Pelosi set to step in after racial remarks by a conservative member of the House crossed the line. Good Monday afternoon and welcome to BNC Live. I'm Tishani Whitlow. A busy news day for you, so let's get right to our top story. Omicron concerns aboard a cruise ship based in New Orleans. Officials say a probable case of the variant was detected in a crew member of the Norwegian cruise ship. Now at least 16 other people aboard that same ship testing positive for COVID. And as Sherman DeSalle reports, some passengers had no idea until they got off the ship.
Very stressed and just want to get out.
Passengers from a recent Norwegian breakaway cruise react to news of COVID-19 cases ID'd on board. The State Department of Health reports 17 cases among travelers and crew members, with one possible Omicron variant case. A spokesperson for NCL says all of them are asymptomatic. There's mixed reviews from travelers on how the situation was handled on the water.
Captain came on, he said, we're going to test everybody. I couldn't believe how organized they were. The minute they announced they had everything set up, all the people ready to go, it took us about 20 minutes to go through the line to get tested. It was amazing.
It was deck by deck.
They tested everybody yesterday, but they didn't tell us. I found out on Facebook, and I think it's extremely irresponsible. They didn't even just let us know.
This as new COVID cases are averaging more than 100,000 a day, according to Johns Hopkins. The last average with those numbers happened in October.
Before we set sail, let's set a course for health and safety.
Per the cruise line's policy, everyone on board is required to be fully vaccinated. And NCL states they implemented quarantine, isolation, and contact tracing procedures for identified cases. So far, no reports of these cases becoming problematic for those who traveled on the breakaway, and passengers set to sail on the vessel's next adventure are prepared to deal with the uncertainties.
There's going to be certain people that can get it, and then other people, it'll just kind of skip over. So I'm not really worried about it.
The new cases once again raising concerns about cruise ship safety during the pandemic. All right, joining me now is Dr. Yolandra Hancock. She is a friend of BNC Live. Always a pleasure. Welcome back, Dr. Hancock. So the cruise line requires COVID testing prior to setting sail for that week-long trip. Is it likely that someone may have gotten infected at one of the ports of call, which stop Mexico, Belize, and Honduras? You think that's possible?
Absolutely. It's one of two things. Either they tested negative upon going on the cruise ship, but still had not what we call seroconverted, meaning they had sufficient virus for the test to come back positive, or in one of the ports, they interacted and acquired COVID-19, which is very, very possible.
Yeah, all right. Well, considering those international stops, let's discuss contact tracing now. I mean, how much of that is involved? I mean, 3 different international spots.
It's nearly impossible. There's no way to be able to trace where each individual person was in terms of their exposure. Hopefully it was that one index case that facilitated the spread to the other 17 individuals, but there's no guarantee that that is the case. Again, they tested everyone once yesterday upon arriving, but there are some people who will likely become positive today, tomorrow, all the way through around about 7 days out. So we can't be comfortable in knowing that just because the majority of folks tested negative yesterday, that they will continue to test negative. I can imagine that you're going to see more positive tests coming out of this cruise.
Dr. Hancock, talk about how the virus spreads. I remember hearing that Delta, which is the majority of the cases here in the U.S. at this time, spreads between, 7 to 8 people. Is that true?
Absolutely. So the original COVID-19 virus that hit us back in March of 2020, one person could infect 2.5 people every 5 days. With the Delta variant, we would see that one person could infect up to 7.5 people every 5 days. And now data just came out yesterday from scientists in South Africa that the Omicron variant is at least 3 times more infectious than even the Delta variant. So you multiply that 7 times 3. and you end up seeing even higher numbers. So if the Omicron variant is the one that facilitated infection on this cruise, again, expect to see a domino effect where we will see more tests resulting in positive later on this week.
Dr. Hancock, I'm still trying to pick my lip up from off the ground right now. You said 3 times more contagious as Delta. Talk about what the next 6 months looks like for us at this point.
You know, as both a pediatrician, as a mom, and as a public health expert, it makes me clutch my invisible pearls,
Absolutely.
right? We know that there's seasonality to COVID-19, as we've talked about before. Coronaviruses like the cold weather, 1. 2, we go indoors more. And then now we're dealing with this Omicron variant that is 3 times more infectious than even the Delta variant. And the data that came out yesterday also shows that children under the age of 5 are now disproportionately impacted by this infection. In South Africa right now, the top group hospitalized because of Omicron are 60 and older. The second highest group is our 5 and under. And as you know, Tashani, we have yet been able to vaccinate our under 5-year-olds. Luckily, my daughter is not only 9, but she also received her first COVID-19 vaccine last week. But for parents of children that are 5 or under, it makes me very, very nervous. And it again speaks to the importance of our basic public health practices: masking, social distancing, testing, and isolating if you think you've been exposed. So for those folks who stepped off that ship yesterday, you need to isolate, you need to quarantine, and you need to retest.
All right, Dr. Hancock, we got about a minute before we go to a commercial break. I know you're coming back, but I mean, talk about the dent that this puts in our holiday plans.
It should, Tashani, my worry is that it won't. There's a lot of complacency and decreased perceived risk for a lot of people, both for those of us who are vaccinated and those who are not. The same intensity and fear that we experienced this time last year just doesn't exist. There are now policies in place to block our ability to put things like mask mandates in place. I would say for everyone, rethink your plan. Make sure, just as we talked about for Thanksgiving, test, say you have your virtual experience if you need to, and make sure you get vaccinated.